It is really a pleasure to meet you and very thank you for this interview opportunity for BETV Business News. So firstly, I'd like to know about you, your background, like your responsibility here in International SOS.
Thank you very much for having me. My name is Guillaume Sautier. I am the country manager for International SOS here in Myanmar. I've been doing that for about 3 years here in this country where I live with my family. And I've been with International SOS Group for close to 10 years, mostly in Africa and Middle East. My responsibility here is to look after most of the operation for International SOS Myanmar, as well as our clients' engagement and relationship in country.
Can you explain what is International SOS and what are the key businesses that you have been focusing doing here over the last 30 years?
So, as you said, we're in Myanmar for close to 30 years, which is about the same age as the International SOS Group, right? So we started 35 years ago in Indonesia. The group was founded by two French gentlemen, a doctor and a businessman. And they realized while in Indonesia that international workforce, or let's say mobile workforce, were lacking a bridge between what's available locally and international healthcare, right? So it was mostly about medical evacuations or things like this. And that's how they almost kind of invented the sector of medical assistance. So medical assistance is an activity in which if you find yourself in a situation, right, that medical distress situation, you want to be able to pick up the phone and speak to a doctor, ideally that speaks your language, or at least English, that will help you, right, dealing with the situation. So that goes from simple referrals all the way to acute emergency, which would require things typically like a medical evacuation or repatriation to your home country. And then from there, we've established ourselves in lots of countries. And Myanmar was some of the first, since we started in Asia. Most of the first countries where we established was in Asia, and we've expanded into many different type of services, right? So I think if I have to name a large activity as well, would be our remote site services, right? So if you are a company that operates in a remote site, you have nothing around you, right? There's no hospital, there's no clinic, there's nothing, right? But still you have to operate in that place. So you would call a company like International SOS to have a clinic, have a structure, right? To be able to look after your workforce, right? On site, be able to stabilize, you know, in case of emergency, or provide primary care and evacuate, you know, this workforce to a place where they can get further treatment.
By the way, how many branches you have opened and spread in Myanmar, so in some remote area?
Remote area, we have between 30 and 40 remote sites, right, spread across the country. We've got only one, I would say, walk-in clinic, right, open to the public clinic, which is here in Yangon at the Inya Lake compound.
Yeah. You have many experience, so related to the country's medical services business. So what are your thoughts about the opportunities in the medical service sector and challenges? How would you say about this?
Right, so obviously International SOS, we operate in a very special zone, right, of healthcare, as I said, looking after predominantly to mobile workforce. So it's when you're on the go, right? So Myanmar traveling inside Myanmar, Myanmar outside of Myanmar, or foreigners coming into Myanmar, and we operate that bridge, right? And that we try to plug, you know, the capability or deficient capability. So overall, right, I think Myanmar is definitely a place that is lacking a bit of skill set when it comes to doctor. I think the Myanmar University are not producing enough doctors, for example. But I think the direction is good, right? There's definitely the will, right, of the country to keep the people inside, and for people to receive the treatment inside of their own country, which is obviously a very good thing. And but it requires investment, and requires, you know, the right level of skill set and training.
Good afternoon, I'm Dr. Pierre. from International SOS Clinic in Yangon. How are you?
Recently, you have developed the teleconsultation services. So why did you develop this kind of services for the Myanmar medical health sector?
So teleconsultation has been a project for the International SOS Group for a long time, right? And actually we've had the technological capability of doing it. But it's true that the COVID recent crisis has sort of accelerated that agenda for us, and very quickly when we realized that people were not that comfortable maybe to come to a clinic, that has, I would say, in a healthy way forced us into really ramping up with our teleconsultation agenda. So very rapidly we've been able to develop tools and professional tools to develop teleconsultation at our Yangon clinic, which we're providing in English in Myanmar language with video conferencing capability. And then more broadly, right, International SOS Group as well is now capable to deliver in many countries teleconsultation services for our members calling over the phone from wherever they are.
Did you feel that the impact from the COVID-19 suffers your business, International SOS? So how do you think that?
I think International SOS as part of that business community will be suffering from the economic downturn, like probably everybody else, right? Except a few gifted sectors. But it's also another fact is that International SOS has been supporting a lot of clients in the time of the COVID-19, right? So we've had a lot of high-level engagement with our clients, CEO level, and not only on the ground as well, to support them with expertise, right, as consultant to these organizations, to help them face the COVID-19 situation, right, to resist, react, and restart their operation. So on that level, that has kept us very busy, and for a lot of our clients, we've become more, I would say, unavoidable than before.
The businesses around the world have been going slow since 6 months ago. So what would be the business continuation plan of the International SOS? And how should Myanmar businesses prepare to survive?
Business continuity plan. So having a strong, up-to-date and executable business continuity plan is critical. That business continuity plan needs to be expert-led, especially in COVID-19 context. Meaning expert-led means, for example, a doctor, right? Because COVID-19 is a medical issue, you need to get your information, you need to get your advice from trained medical doctors that know about pandemic plan and know about how a pandemic typically evolve, how the virus spread, this type of advice, right? So that's very important. You need also to provide on-the-ground support, right? COVID-19 is a very intimate issue. It touched the people directly, it touched the people at work, it touched the people in their household, right? So, and as a company, right, we cannot not factor that. So the typical thing that you have to think about is the infection controls, right? The protective equipment, this sort of things, right? That you need to be ready to provide to your team and in your workplace. There's also a very big issue which has come, which was out there for a long time, but the COVID-19 has really surfaced it and revealed, and that's the mental wellness, or sometimes we call it life resilience. I think especially work from home and all this environment of bad news around us has put a lot of people under stress. In particular in Myanmar, right, work from home is a challenge, right? With unstable electricity, unstable internet, usually a lot of people living under the same roof with lots of noise, and your children not going to school anymore. So work from home has been tough for, I think, the whole world, but in Myanmar probably a little bit tougher. And that puts stress into the people's mental resilience and the way they cope with it. So we've seen a lot of requests, right, to support our clients with regards to these aspects of mental and life resilience, which is becoming more and more important, and I think it will survive after the COVID era. It will still be something that most of the organization will be focusing on.
So our lives have been changing in others the way like daily lifestyles and operations. So do you think the medical service businesses were transformed in another way? So as I have told you, there is a shift to lifestyle and operation.
Teleconsultation, which I think is a huge change. There's also a lot of healthcare services where you cannot avoid contact. Okay, so I think we're going to have to become more stringent about protective equipment. We've seen that our frontliners, as we've been calling them in the news, our healthcare workers, right, were in contact with the patient because you have to. And I think we're going to see a lot of more protective equipment in healthcare, in hospital, a lot more screening. Probably stricter policy with accompanying family members, for example, right? It's all around the social distancing, really. At the end of the day, in many conditions, you have to see the patients. So so you have to do as many protective and prevention measures as you can. But again, it's something intimate, right? And sometimes you have to operate, you have to see the patient, you have to touch and diagnose. So teleconsultation is not the solution to everything, but with technology, I think a vast majority of primary health care can be managed remotely now.
What have you learned lessons from the epidemic for the Myanmar?
I think the biggest lesson learned was probably a reminder that once again, every organization, most important asset is their people, right? I mean, there's nothing that will move, there's nothing that would progress, there's nothing good that was going to come out of your organization without people running it, right? So if you don't look after them and if you don't put yourself in a situation where you cannot continue running your operation, you will be in big troubles. So I think that's sometimes, I hope for many organizations, we refocus, right, some of the efforts into their people, into the wellness, into non-communicable disease, right? So that's also a big issue. It was here before the COVID, right? I'm talking about your cancer, your heart attack, your not healthy lifestyle, all of these conditions, right? The COVID is not taking those away, right? It's still there. So I think there will be a shift again into focusing into the people well-being.
All right, Mr. Very, thank you. What else would you like to add?
Just a big thank you for having me for this interview, and hope to see you as well in our clinic in Yangon. And if your organization has any questions with regards to a COVID-19 situation, if you want to have access to our experts, please give us a ring.
Thank you.
Thank you so much.